Good morning, good morning, good morning. Hi.
Good
Hello from sunny Las Vegas. Hi, Stanley.
good morning, Nicole, and good morning, everyone, and welcome to day 3 of the Minorities for Medical Marijuana Health is Wellness Week. So, if you've been with us this week, you've learned that lupus. We've talked about sickle cell. Well, today we're going to talk about another condition that affects 1 in 100 people in America. That condition is rheumatoid arthritis. I am your co-moderator, Stanley Atkins II, also known as the Canamedic. I have also Nicole Buffon with me today as we discuss rheumatoid arthritis. We got some feedback. So, what is rheumatoid arthritis? I know we hear a lot of people say, hey, well, I suffer from arthritis or I'm limited by my arthritis. Well, I'm going to give you the technical definition of arthritis, and then we're going to break it down to a little bit more personable definition of arthritis. Rheumatoid arthritis, as defined by the American College of Physicians, as a chronic disorder that causes joints to become painful, stiff, swollen, and deformed. So I'm sure we know people that have been affected by this disease, especially persons over the age of 40. And a little bit of technical information about arthritis. In rheumatoid arthritis, the affected joints become stiff and swollen, but that's due to inflammation of the synovial membrane. That's one of the membranes that actually covers your bones and your joints. And during these flare-ups, patients become stiff and it becomes very painful. Well, why do we want to talk about this? Because it affects so many of us. I, for one, suffer from another type of arthritis known as osteoarthritis, and it's usually caused by the degenerative cartilage. So it's known as a degenerative disease, and the cartilage in between the bones and joints decides to deteriorate, whether injuries, surgery, trauma, or from natural occurrences. So when patients are suffering from these flare-ups, their ends of their joints become very inflamed and it's very painful, often limiting mobility or even their motivation to move. So if you or someone you know may suffer from chronic arthritis, osteoarthritis, rheumatoid arthritis, then today's show is definitely for you. We know that cannabis is a great anti-inflammatory, and that is why we wanted to make sure to keep the conversation going, to say why, because we know there are thousands of products on the market. Well, the information that we're going to give you today may help you bridge the gap between cannabis and arthritis and how that pathway in the middle could be your path for success in your health. And Nicole, I'd like to introduce my co-host, Nicole Buffon. Nicole, welcome and good morning out there in sunny Las Vegas.
Thanks so much, Stanley, and thank you for that breakdown. Thank you for helping us to understand a little bit more about rheumatoid arthritis. So happy to be here with you all. Nicole Buffon, Western Regional Director for Minorities for Medical Marijuana. And I'm also a cannabis patient. I'm really excited about today's conversation because just recently, I have implemented more treatment practices, different modalities for managing my pain, my inflammation in my body, which is caused by the HIV virus. And a lot of times when in my research and understanding rheumatoid arthritis, it's this inflammation in your joints and your bones and your muscles that really prevent you from having the quality of life that you want. Of course, being a cannabis advocate and understanding how the endocannabinoid system works and knowing how anti-inflammatory the cannabis plant components are and compounds are, I knew that there must be a correlation between rheumatoid arthritis in general, osteo, and the others, and using cannabis to help treat that. And of course, also using your diet. You know, we always come back and kind of been a reoccurring theme here. And for our week of autoimmune disorders is talking about how you create a lifestyle change. How do you change your lifestyle to help manage these symptoms? We're not talking about a cure. Most autoimmune diseases are incurable. That's what the Western philosophy is. But when we talk about treating and managing the symptoms of these types of diseases, there are other options out there besides steroids, besides synthetic anti-inflammatories. We're talking about natural medicine, Chinese practices, and herbal medicine. And I'm so excited today, you all, to really get into a conversation with my acupuncturist, Dr. Nina. She is a practicing clinician here in sunny Las Vegas. And she actually has introduced me into a form of acupuncture that I've never experienced before. I mean, I've gotten acupuncture done before I had it with Dr. Nina. And one of the things that I really liked about Dr. Nina was her ability to to manage her needles. So before you get poked by Dr. Nina and her needles, she has a conversation with them. They're her staff, part of her staff, and there are not any pain allowed from these needles. And she tells them that.
Well, that's great to know, because oftentimes many people are intimidated by needles and things like that, especially in the medical setting. And that is why today's conversation is very important, because I actually have personal experience with using acupuncture to help mitigate some of my arthritic pain. And I will say the results were phenomenal. And for a lot of people who say, well, I'm not old and I think I have arthritis in my knee or my shoulder. Oftentimes, ladies and gentlemen, if you played sports or if you have been in an accident, the damage caused at that joint, that's where you will develop the arthritis. So for me, I have arthritis in my left hand. I got my right hand crushed in an ambulance door years ago. I have arthritis in both my feet, as I've broken, I think at this point, 9 of my toes. Yes, and as well as arthritis. I was diagnosed with bilateral osteoarthritis at 26 years old in my knees. So it's going to be a great conversation today. We have firsthand experience, and we have professionals on board today that's going to bring you the real information. So without further ado, Nicole, you'd like to introduce our guest?
Hi, good morning or good afternoon, wherever you're tuning in from.
Thank you so much, Dr. Nina, for being here with us. We are so excited to learn more from you about your many practices. So I don't want to take up any of the time of you introducing yourself, because your extensive knowledge about Chinese, ancient Chinese practicing and medicine and indigenous forms of practicing medicine is so vast. And so I'm so excited that you get to be here today to talk to our patients. Full disclosure, I was on her table yesterday afternoon getting my acupuncture treatment, that I am a regular visitor in her office. I also am part of the coalition that she's formed, and I'm going to let her talk a little bit more about Tribe with Roots. Yeah, so please introduce yourself, Dr. Nina, to us.
Thank you.
Thank you for being here.
Yes, so I am Dr. Nina. I go by, or just Nina. Most people don't call me doctor. We're very relaxed in the office. I have built a clinic. We have 4 doctors on staff, 3 OMDs. So in the state of Nevada, there are no acupuncturists per se. You have to be a licensed doctor, practitioner, trained in Chinese medicine. So we don't have LACs in the state of Nevada. In other states, they do. So we have 3 on staff. We have a doctor of naturopath on staff, and then we have about 12 other practitioners who do medical support, like facial reflexology, which is, I'll touch on that later because it's a wonderful way to relax rheumatoid arthritis patients without manipulating their bones and joints. We do have massage therapy, hypnotherapy, a medical Reiki physiologist, and a lot of other ancillary practitioners who we are trying to recognize natural ways and incorporate it as a true medical modality. Not you don't need a synthetic pill to do the trick all the time. And we do offer a lot of support in a lot of different ways to all of our patients here. I myself am, my mother's from the island of Sumatra. So I grew up with what we call native Jamu medicine. that's kind of just how I just thought that was normal growing up, and found out later not so much. And that really opened the door for me. I went into the mental health services first. My first master's was in psychology. So I worked with a couple of cancer institutes and foundations here in town, volunteering with cancer patients. I was working with the terminal side, so working with how to better get them a quality of life and work with their families and the anxiety and the stressors that come with that. Got very frustrated with trying to get people off of meds that weren't really doing anything other than changing their quality of life for the worse, and got a lot of backlash, got very frustrated, and got tired of complaining, and decided to put myself into med school and do something about it from the inside. And so that's how I ended up with the lab coat. I just got frustrated and decided somebody needed to do something. So now I'm back in the medical system and trying to buck the system with herbology and acupuncture and all the other things I mentioned before. So that's just a little bit. I have studied around the world. I worked in Shanghai at Longhua Hospital for a while. That's the getting thrown in the deep end of my medicine. Came back here with a lot of tools and tricks for people on the Western side. So I'm excited to share what I know.
Well, welcome, Dr. Tabor. It's a pleasure and an honor to meet you. Thank you so much, Nicole, for inviting such a distinguished guest on today for this conversation on rheumatoid arthritis, because I think that in our communities, there's a lot of misconception. And I'm not going to say people aren't knowledgeable. I think they've just been miseducated on some of these disease processes. And hopefully today we could help some people by bringing them some quality information.
Yes. Yes.
Absolutely. So I want to get started, Dr. Nina. Let's kind of dive right in. Yep. Let's talk about, you mentioned a couple of these practices that you are proficient in. And could you explain to us the difference between a touching treatment like acupuncture and a non-touch treatment like a Reiki treatment?
Yeah,
can you explain, and if there's anything else that is in the non-touch treatment area that you deal with, could you explain to us what those are and how they work?
Yeah. So with rheumatoid arthritis patients, it is very different. And there are, I know this sounds large, but there are hundreds of different kinds of arthritis. So rheumatoid is its own animal. You really have to be sensitive to the body's immune system. And you can't just pump them full of B12 or things that could trigger that immune system to go into hyperdrive. It's going to make their condition worse. So we have to look at these patients a little bit differently than how we would look at other patients. Another key element in our practice is that there's not one way to treat somebody with rheumatoid. There are different manifestations. There are different severities, and people's bodies just respond differently to different things. So we try to start them off with safe, gentle ways to not incur a flare-up. If an acupuncturist, if an OMD doesn't know what they're doing really well, they can make the patient much, much worse. It's very common for someone doing acupuncture they want to help, they want to get all the points, but it can be too aggressive and cause a really bad flare-up. So it's constantly educating the patients that less is more. We're going to go slow and steady. You may not feel a big jump in the beginning, just stick with it because we can't be too aggressive. So then when they are in a lot of pain, and even some of the herbs can be too aggressive, and we have to really focus on food as medicine. So we really pull apart their diet, and I'll talk about that in a little bit. So to answer your question, some of the non-touch modalities that we have are like hypnotherapy. So it can really help with that mental journey, the depression, the frustration, also past traumas in general. When your body is wrapped up in emotional trauma, those are resources that could be allocated to fighting your autoimmune disease. So kind of thinking along those lines. I did mention the facial reflexology. So that's acupressure and reflexology just on the face. And I don't know if you can think about when you've been to the hairdresser and you've gotten a scalp massage, how amazing that feels. An hour of that and a facial massage. It's one of my personal favorite treatments because I feel like my whole body relaxes more than if I got a full body massage. So the patients are able to relax their body, reduce that inflammation, reduce the stress, inner stress, and there's no manipulation to muscles and joints outside of the face. And it's not really something I think a lot of people think about, but we really do encourage it. And our patients here really love that modality. The Reiki. So Reiki can be touch or it can be non-touch. And Reiki is energy work. I don't know if a lot of people are familiar with it, but it's a physical energy working where the practitioner is more of a conduit and helps to relieve symptoms in the body through energy. There's not a lot of Western reporting on it. However, there is a lot of Eastern reporting on it. Acupuncture works because we tap into these energetic meridians on the body, and perhaps in another podcast I can explain to you how that works. I don't think we have time right now, but so that is a very real modality. We have meditation and breathwork courses for our patients, both online and in person. We do medical qigong out in the park with our patients. We'll pick a Saturday once a month, and one of our practitioners will go out there, and we'll all go out to support, and they can do qigong with the doctors. We're very, very involved with our patients in this clinic. That's why we call it a tribe, and that gentle exercise helps to get movement. It helps to reduce swelling. It helps to lift emotions. And, of course, if you're in pain, we don't encourage that, but it is important that when you have parts of your body that do feel well, that you work them and exercise them. And I'm going to explain a couple of those other along that in a little bit too.
Could you tell us a little bit more about Qigong? What is that exactly?
Yeah.
I'll be familiar with that term.
Oh, yes. Thank you. Sorry. I live in this world and sometimes I forget I'm kind of out there. It's very, very similar to Tai Chi. Maybe more people have heard of Tai Chi, which is a very gentle form of martial arts, although it is actually one of the more powerful militant ones, but that's a very, very advanced form that a lot of people don't know. So Qigong and Tai Chi are a very gentle movement where it involves breath work and stretching and coordination at the same time. And it's very relaxing to the body. We're constantly talking about stagnation. So the joints swell, the synovial joints swell, and the calcification happens because of, in our theory, stagnation in the body, meaning you get kind of blockages energetically and physically, with blood flow and lymphatic flow and all those things. So think of a car accident. You have a car accident, possibly it's in the middle of your arm per se, okay? And then everything behind that starts to block up. So back up like traffic jam. So it can back up into your elbow and create quite a bit of pain. So you may be feeling the pain in the elbow, but the blockage may be further down the line, and treating the elbow may not help the issue. And so things like massage, we do have massage therapy too, but massage, movement, stretching, Tai Chi, those things helps to keep the body moving so you can alleviate as many blockages as you can.
The stagnant, right?
Yes.
And that's what the qi is. The qi in Chinese herbal medicine, ancient medicine, and talk is that movement. The qi in your body helps to keep the body energized and keep the body moving. And if you have a disease like a rheumatoid arthritis that specifically attacks your joints and your muscles and your down into your bones, if it attacks those specific areas, moving them is going to help. And like Dr. Nina said, we don't want to move to cause pain, but a little bit of discomfort is okay, right, Dr. Nina? A little bit of discomfort, because the more you move it, then the discomfort goes away, and then it becomes routine. And then the pain starts to subside because you're moving more, right?
Yes, exactly. It's a little bit of an uphill battle, but you really need to it's so important for longevity. You really need to push. And so if it's swimming, because that's gentle, then that's fine. If your hands hurt, then go for a walk. Don't, never push the pain. That's not really going to help you. But figure out what you can do and push yourself in those ways. Yeah.
And
make investments now because they'll pay off later.
Right. Do it now. Right.
Yeah.
Don't wait until it's too stiff that you can't move.
Right.
And for our audience that's listening in and tuning in, please, if you have any questions for Dr. Nina regarding her practices and how it's done, please add it to your comments here so that we can help get your questions answered. Go ahead, Stanley.
So, Dr. Nina, ladies and gentlemen, and everyone in attendance, I know she went over several different parts of her practice. And for some of you, this may seem very foreign. Well, that's a good thing because we're learning a different type of healthcare today. So as she stated, some of her practices involve placing her hands or a tool onto or into your body, whereas some of the treatments are non-touching, in which she uses the energy within your own body to help you channel that to cure you, to help alleviate some of your symptoms. And again, as we stated earlier, I actually have personal experience with this as the VA. Many of you know I'm a disabled military veteran. The VA has now approved these practices for their alternative pain management classes. And
Yes.
to attest to what she said, they don't just do one, because I've done the Qigong and we also did the Tai Chi. So, doctor, I have a little bit of experience of, holding the ball and parting mane and, the sparrow. And I can totally see how that goes right into martial arts. So tell us, from your experience, a patient who's experiencing these inflammation in their joints, whether it's their back or their knees, what are some of the practices such as like acupuncture? How does that help alleviate patients suffering from rheumatoid arthritis? And before you answer that, could you tell us a little bit more, just briefly, your thoughts on rheumatoid arthritis and the amount of patients that you see that suffer from arthritis?
Patients that suffer from arthritis. So in our clinic, we just kind of over time have developed into really catering to the over 50 crowd. I think that has happened by default. That wasn't an intentional thing, but some of the things we do focus on here are hormone balancing, more dietary, digestive issues, and just the over 50 crowd. So the postmenopausal women, and on up. And so we do get a lot. I would say probably, if I had to take a guess, 65% of our patients have some sort of arthritic issue, from sports injuries, just from lack of proper diet and everything in between. So it is a very, very common one here. Of those, that 60%, 65%, I would say maybe a third or fourth of them are rheumatoid or some autoimmune issue related disease. Yeah, so it's pretty common. I do also want to kind of address that the demographic here in Vegas attracts the older community who have these issues because of the weather here. The dry heat tends not to flare them up. So we do have maybe a little bit skewed in our community of people with those issues, just because of the climate here kind of lends nicely to that.
And that's similar to how we get a lot of, they say Florida is the retirement state. So if you're in Florida, which is where Minorities for Medical Marijuana is based, that's sometimes why you see a lot of older retired couples or retired persons in the South, because we know cold makes your arthritis hurt a little more, makes joints a little bit more stiff. Nicole, from your experience, what did you, from going to Dr. To her clinic, what was some of the thoughts that you had when you first, like, this is different, I'm going in here, we're talking about sticking with needles and qigong and energy. So Nicole, from you knowing about inflammation and pain, what was your experience when looking for these different modalities and implementing them to your health and telling others about that?
Well, in full disclosure, I have recently introduced psilocybin to my treatment to help manage anxiety and help with my focus even, and some of the mental and spiritual things that I was dealing with that came to the surface in the last 9 months. And so in partnership with the person that I get my psilocybin from here in Las Vegas, I was introduced to Dr. Nina. And I knew immediately this was the doctor that I wanted to go see. And another good friend of mine, Chef Stacy Dugan, who's a vegan chef here in Las Vegas, she was the one that actually met her in person for the first time and just could not stop talking about her. So of course, getting a referral like that, that was the best way I could have found a doctor like this. After praying about it and asking for the spirit guides to come and show me one. And then it was walking into her office and her explaining to me that she makes sure that she has conversations with her needles, which are her little employees, her smallest employees, but the most important, explaining that they are not allowed to cause pain. And if they do, they get fired immediately. Yeah. And then I've had acupuncture before, but I just mainly had it in my ears and in my head and in my hands, a little bit in my hands, a couple at my feet. And so this was a full body. I my stomach, inside of my arms, inside of my legs. And it was just an amazing experience from beginning to end. And to be honest, she has a lot of tools in her tool basket. I have an infection on my foot, on my toe, my big toe, that I have been dealing with for years. It comes and it goes from a fungus when I used to be a lifeguard. And there she has a blue light in there, a UV light that helps with that. So it's and even being able to needle in around my toe to help with that inflammation. So it's more than just what you think. Rheumatoid arthritis is something internal that obviously acupuncture can help with because inflammation is such a major part. But there's so many other things that Dr. Nina and I, because I talked to her intimately about everything that's happening with me. And I was just really, really so happy and so pleased that I was able to find such an amazing doctor like this that has welcomed me into her tribe of other healers. And I'm really excited because one of the things that I have not been able to quit in my quitting sugar, quitting meat, quitting dairy is eating ice. Okay. It's something. I'm anemic. And so it's something that comes along with that anemia, and you don't realize how much it takes a toll on your body, especially your internal organs, and slowing them down. And acupuncture has helped me with that. And so the last step that I'm taking to get rid of this addiction, that's what it is hypnotherapy. So that will be my first time experiencing that. And it's also another service that she offers within her office. Yes. So her name on Instagram is the Good Witch Doctor. And so I can honestly say that I have been treated by the Good Witch Doctor. And I'm so honored to be a part of it.
Thank you for sharing. Thank you for sharing. Yeah. I saw that we had a comment, and Dr. Nina, I want to make sure we stay on topic about this rheumatoid arthritis. So there are a lot of people where a lot of these different treatments, they're going to have to ease themselves into it. But for a patient that suffers from chronic rheumatoid arthritis, what are some foods or some dietary things that you would suggest to help them reduce this inflammation? Because I know that through diet, a lot of inflammation in the body can be mitigated. So what are some things you could tell us about the diet to reduce symptoms by foods?
Oh, good. We're getting to the good stuff because this is the crux of what I do. Acupuncture is half of it, but we do also on site have a full raw herbs apothecary and a full herbal dispensary here. Not with cannabis, but with Chinese herbs. So we have all our prescriptions are right here. A lot of them I make by hand myself. And so as far as an herbal prescription, I'm really going to refer to you to go to an OMD in your local community and find what is right for you, because I customize all my formulas and my prescriptions to the patient's specific needs. But today I do want to share some very common food or food types to look for and things to avoid. That's just as important as what to intake. And why this is so important to me is my patients who have the best success with rheumatoid arthritis, and success looks like mental health, lack of getting good sleep, no insomnia. It looks like no digestive issues, and more importantly, no pain and inflammation. So the patients that have the most success are the ones who are impeccable with their diet. It is a little bit of work finding the things that you like even better than what you're used to eating. But that's the trick right there. Search, play with foods, and find things that you can fall in love with just as much. So for example, I love to eat brownies, but they're not good for you. I don't want to have the gluten. I don't want to have the sugar. So I found a recipe to make brownies with black beans, and you puree them with a little bit of honey, a couple of eggs, and cocoa powder. And the entire batch comes to about 140 calories, and they taste just as amazing. So I can eat a whole batch of brownies and get 140 calories of protein, basically. So it's the tricks. And we teach, when all the practitioners, when we find a great recipe, of course, we share it with everybody. It's like, guess what we found today? And so for that week, we're like, pumped, and we love sharing little tidbits like that. But let me give you some practical information, because this is kind of important when, especially with rheumatoid patients. The number one thing that you want to integrate into your diet, and I would go as far as to say 30% of every meal, is healthy fats and oils. Healthy fats and oils. So you're looking at, excuse me, let me take a sip of water because I just got dry.
Living here.
We're going to talk about hydration in a minute. Hydration is, I don't go without this anywhere. Hydration is key for you guys. Okay. Healthy fats and oils. Those are your avocados, your olives, your nuts and seeds, especially the nuts and seeds. A lot of cannabis products have great oils, CBD oils, coconut oils, things of that nature. This is a joint inflammation systemic issue. This is an autoimmune issue. And so you get that heat and that swelling and the redness from the friction in the joints and from the stagnation that we talked about earlier. And so those oils help to lubricate that, keep them smooth, keep them fluid, so you minimize that friction. And it also feeds the brain. Your brain runs on fats and healthy lubricants. And so you need that for healthy, clear thought processes and mood, right? So that's the number one. Number two is we're going to think about things that you want to mitigate inflammation. And so a lot of people know turmeric is a very common one. People already kind of know about that. But one less known, I want you guys to write this down. It's bromelain. Bromelain is a really important ingredient for reducing inflammation. And there are some easy foods that are high in bromelain that can really help you. It's an excellent source for your body to assimilate and reduce inflammation. So those kind of foods look like pineapple, mangoes, avocados. So now you got a double win with the avocado, papaya, and even ginger. Ginger is an herb that I use in a lot of my recipes. It's called shenjiang, and it helps. It has that bromelain, and it really helps with anti-inflammation. The caveat with that, however, is that ginger is a hot, spicy herb. And so if you're having a flare-up and you've got that redness and swelling, we're going to not do those hot, spicy herbs during that flare-up. And I'm going to get to that in just a second. So bromelain. The other one you may not be as familiar with is sulfur. You want foods with sulfur. And I like to explain why. Sulfur helps your body absorb calcium. Calcium is essential for keeping that bone density and for repairing bone damage. And so when you have arthritis, you're having bone damage, and the bone is trying to repair that damage, and it thinks it's repairing it by putting this calcification over it, and that's what kind of creates the deformity and whatnot. But the sulfur also helps to repair it in a way that it doesn't create those extra osteoblasts and calcifications. It also repairs the cartilage. It also repairs connective tissue. So now we're back to that synovial issue with rheumatoid. So things with sulfur are asparagus, eggs, fresh garlic, another spicy herb. So we're not going to do that with a flare-up, and onions as well. So understanding what your body needs. You need foods with sulfur. And I don't think people hear that often enough. And I will tell you, I had this conversation with Nicole before. I will tell you, don't get too bent when your Western MDs do not give you nutritional advice. I'm not sure with every state, but I do know in the state of Nevada, it's actually malpractice for a Western doctor to give nutritional advice. They are not trained in med school. This is not their medicine. In Eastern medicine, food is medicine, so that's all we do, so it's in our scope of practice. However, Western doctors, that is not the case. Their medicine are pharmaceuticals, so they're trained in synthetics. They're trained in their brands, and that's what they do. If they have not gone on to get CUs and further certification specifically in nutrition to give nutritional advice, and they do so, it is considered malpractice and they can be fined. So you have to understand that is a nuance between Western and Eastern medicine. People get very frustrated with their Western doctors, and you need to understand that's not really their wheelhouse. This is why they work with nutritionists and dietitians and refer you therefore. Okay, so don't be too hard on them. They frankly may not know.
My mind was blown when she shared that with me. I could not believe. And I guess that explains a lot why when I'm speaking with the doctors at clinics that I might go to, they are opposed to me consuming large amounts of dark leafy greens versus pushing the prescription drug or the prescription synthetic form of iron on me.
Right.
And because I'm anemic, and so that's the first thing that they want to do. They want to give me iron, and they want to send me home with iron pills. When I have to go to the hospital to get a blood transfusion, that is the first thing that the doctor wants to prescribe to me. And I'm like, if it'll get me out of here faster, you can write the prescription. I'm not going to take it. Right. But it's because of all of the side effects that those the synthetic iron causes in the body. And when I try to say, the doctor has told me this before, I said, well, I just will have to increase my dark leafy greens. And they're like, you're going to have to eat a lot of spinach. And I'm like, well, that's what I'm going to have to do. And so it's funny how when you explain that to me, that they will participate in malpractice if they actually give me nutritional advice versus writing me a prescription for a vitamin C pill, because that's what's necessary in order for me to get the iron that I need to make sure that I have enough vitamin C so that it absorbs that iron. Right? And that's something I've learned because I'm anemic. And so I understand that. And so I choose to eat foods and consume foods that are high in vitamin C versus taking a vitamin C pill.
Right. Excellent.
So I know we just shared a lot of information, ladies and gentlemen, but I want you to absorb this similar to the way sulfur helps you absorb calcium. So I want you to remember that. And some of these notes and some of these foods, be sure to write it down. I know we're in the digital age and we're in the eco-sustainability age. Go to your phone, go into your notepad right now. Take some notes, text it to yourself so that you can remember it. So, doctor, one thing that I learned in healthcare is, especially when treating emergencies and emergency patients and things of that nature, it's easy to memorize all the things you need to do on the positive side. That's the easy thing. Yes. But for a lot of patients, those are the hardest things for them to do. So I'm here in the South, and the South disproportionately represents a lot of different healthcare conditions. We have a lot of arthritis, a lot of gout and diabetes and things of that nature. And a lot of it comes from diet here in the South. So you've told us some of the good things that patients can eat and that just people can eat to help maintain a healthy lifestyle. But what are some of the foods to avoid? Because it's hard to tell people to eat these healthy nature and things of that nature. We got to kind of ease them into it. So give us a few examples of foods to avoid if someone is suffering from rheumatoid arthritis.
So that's not as fun. They don't like this list as much. So avoiding alcohol, because that can really create a lot of inflammation and it taxes the liver, it taxes your resources. And so anytime you're doing something that pulls your internal resources away from fighting and accommodating your autoimmune, you're looking at risking a flare-up. Okay, so sugar is not good, and acidic, in the vein of sugar, acidic foods. So when you put acidity in your body, your pH levels of your blood have to stay between 7.35 and 7.45. It cannot deviate. There a lot of things go wrong when your body deviates from that blood pH. When you're dumping acidic foods and sugar and alcohol and dairy in your body and creating that inflammation, your body gets very acidic. How does it get itself back to homeostasis? How does it neutralize that acidity? It pulls calcium out of the bone, dumps it into the blood to alkalinize the blood and bring it back up to that pH. So now you're stripping your resources that you need the most and putting it somewhere where you really don't need to be putting it. When you strip that calcium out of the bones, you're making yourself susceptible to osteoporosis later down the road and kind of exacerbating your rheumatoid condition. So that's super important. Another thing you can do to kind of mitigate and maintain that bone density is resistance weight training. I know that sounds so scary when you have rheumatoid arthritis, but building that muscle mass around the bone builds bone density. And that really, again, is going to be a game changer as you get down in those later years, 80 and 90 years old. So you need to do what you can now to do that muscle building. If your knees and your joints hurt, then work on your back and your arms. If your back and your arms hurt, work on your legs. Do what you can, but that bone density and lowering your acidic foods really is a game changer. You also heard me talk about ginger and onion and being really hot and spicy. A flare-up is heat in the body. It's friction. And so you want to avoid those hot spices: cinnamon, garlic, ginger, cloves, citrus foods. And two that people don't think about that in Chinese medicine are considered spicy herbs are basil and rosemary. We do integrate those into our diet. If you're having a flare-up, no bueno. You don't want to do that because you're going to, again, exacerbate the condition. Then on the flip side, integrate nourishing, cooling herbs and foods and kind of teach yourself what those are. It's yams and potatoes are nourishing and cooling. It may not be something we all eat, but they're very good for people with RA. Radishes, people think they're spicy because they taste spicy. Actually, the medicinal property of radishes are cooling. Cucumbers and melons make a little more sense. Peppermint, beets and turnips and carrots. Those are all really good foods. I know I'm talking fast. For a flare-up condition. So.
And you breezed by it. I just wanted you to touch on it one more time. Dairy. Since I have gotten rid of dairy in my diet. Anytime, I was at dinner a couple of weeks ago at an Italian restaurant. Their vegan or plant-based options were very limited. And so I had a salad and I had an eggplant parmesan, a roasted eggplant dish. And so, of course, everything without cheese. But when I went home that night and woke up the next morning, I had the mucus in my eyes. I had the body aches even, and a lot of mucus that I was bringing up that next morning. And I just knew that somehow it had cross-contaminated, whether it was butter or some cheese that had gotten into one of my dishes. I knew it immediately because now that dairy is out of my body, when I come into contact with it, when I digest it, my body tells me immediately, and it does that by expelling the mucus because I'm drinking my water with rosemary and I'm doing all these things to help get the mucus. I'm having my sea moss and doing all the things to get the mucus out of my body. And so when I come into contact, dairy is it is, and it was probably the hardest to give up because I love cheese and I love milk. No, but I scratched that. It was not harder than sugar.
Yeah.
The legal cocaine, that stuff right there, man, they put it in everything. And then if you read your ingredients, like I have to constantly, high fructose corn syrup is just synthetic sugar. They just named it something else and very cleverly made sure that they put that in everything.
Yes. Yeah. It's dairy, dairy is not really a part of Asian diet. It's and so I didn't grow up on it. So when I have the same thing, I react very quickly. But I will say cheese is one of the hardest things for patients to give up, because there's some components, I won't get into the chemistry of it, that fires off the brain receptors very similarly to cocaine. And so it is hard for people.
I believe it.
One of the ones that people have the hardest time eliminating from their diet. I didn't mention, I just wanted to mention one other thing. Just write down histidines. It's an amino acid. That's another one that everyone with RA wants to integrate into their diet. And the reason why I kind of want to interject it in is because you mentioned your iron and your anemia. It removes high levels of copper, and if you kind of dip, because a lot of people are supplementing their iron, you can kind of swing the other way with overdoing the supplements. And so if you get too much, and also because you have an autoimmune, your body may not always be processing it correctly. People with RA tend to have higher levels of iron in their blood at times. That's something we're trained to look for. And so you want to integrate foods high in histidines to help kind of pull out those high levels of copper and iron. And those are things like rice, wheat, and rye. I know a lot of people have gluten issues, but if you do not, those are good to integrate. So again, everybody's a little different. Yeah,
Great.
a lot of information.
We're touching on something that I really love to talk about, and that is dairy. Because that is one of the number one culprits in a lot of disease processes, ladies and gentlemen. So if you do suffer from rheumatoid arthritis, try to avoid the alcohol, try to avoid these sugary foods, try to avoid the excessive amounts of dairy, because I've met a lot of patients that say, hey, when I drink milk, I get sick. And I tell them, they're like, I think I'm lactose intolerant. I tell people very often, you're not lactose intolerant. You're just not a baby cow. Milk, especially cow milk, it was designed to make a baby cow an adult cow, to help it grow. It is very foreign to our bodies. So, ladies and gentlemen, inflammation can be reduced by reducing the mucus. Where is that mucus and that fat coming from? The dairy products. So, doctor, I know we're running low on time, and I do want to say, so today, you would say, what is the first step for patients who suffer from chronic arthritis, who suffer from the rheumatoid arthritis? Because I saw a relative of mine who came into the chat, and I know that arthritis completely runs in my family. My father's had multiple knee surgeries. My sister's had multiple hip surgeries. So starting today, I know acupuncture and different things. What would you say is the beginning, the first step for these patients who suffer from this debilitating disease, especially with the fall and the weather looming to really cool off and increase the inflammation? What are some things they can start with today on the low impact side to really begin their transition to this natural lifestyle?
Yeah, the first thing I would recommend is finding a practitioner advocate who's going to sit with you and customize a treatment protocol. If your doctor isn't doing that, then find the doctors who are, because there are a lot of us out there doing that. So I love it when my patients come in, I deep dive, what are your symptoms? You want those patients to tell you, are you feeling hot or cold symptoms? I'm going to treat you differently. Where are you having the redness and swelling? What makes it better? What makes it worse? How are you affected by movement or lack of movement? How are you sleeping? How are you pooping? How are you eating? I need to know all those things so that I can customize your specific treatment plan. That's the bare minimum that you should be getting from your doctor. And they should be your advocate. Then build a team. One doctor is not a team. You need to build who is your team to help you manage this. Who's the nurse at the dispensary giving you advice on the correct strains? Who is your mental health practitioner? Who's helping you talk through some of this frustration and the things that you're dealing with on the daily life? Who are your family advocates? The other thing is that the next step I would really push, and we're very heavy on promoting mental health, is learning how to communicate your boundaries. So important, because this is a disease that often goes unseen until you get to that phase where you have that deformity, which we hope to keep you out of. How do you communicate to people when you're feeling overwhelmed? Learning to ask for help, learning to take naps and downtime and meditate and do your breath work. And that doesn't come inherent to everyone. We weren't all raised in this lifestyle. So finding advocates for your team to help train you in how to manage yourself in those ways. Be very honest with your practitioners and all the supplements that you're taking, including cannabis items. Those are really important pieces of information that I work with, not against. I'm not here to tell you, unless I think something is really countering. I'm not trying to tell you how to change your entire lifestyle. I'm trying to teach you how to integrate things into your lifestyle that work for you. And that conversation is so different from patient to patient. Every patient is completely different. And what works for one, I may not recommend to somebody else. That might be counterintuitive in their specific situation. And then also be really clear to communicate to your doctors what you struggle with in your daily life. Those are clues. Everything you say is a clue that helps me put the pieces of the puzzle together on what's happening inside your body. And if your doctors aren't doing that, then the doctor's falling short. Find the ones who are.
Find a new doctor.
I don't know how else to say it.
Find a new doctor. No, that's the simple truth.
That's the minimum.
Yeah. When we talked about this at the beginning of the week, autoimmune disorders, or yesterday more, autoimmune disorders in general get misdiagnosed. A lot of times it can take anywhere from 3 to 7 years to actually get diagnosed. You have to go to doctor after doctor to get different tests done to determine what is actually going on. And I wanted to stress something that Dr. Nina said about really becoming your own advocate, educating yourself. In the state of Nevada, they test for terpenes here in the state. So all the products that are in the dispensaries, they don't do that in California. They don't do that in Colorado. So all of the products that come out of the dispensary that are on the shelves at the dispensary have to get tested for terpenes. And so educate yourself, empower yourself with the information that is readily out there and available for you to seek, that there are terpene profiles within the cannabis plant that are have anti-inflammatory properties. And so, maybe you find the right strain or cultivar that can help you with your symptoms and managing those symptoms. But if you live in a state like Nevada, really take advantage of knowing and understanding your terpenes, because then you don't go into a dispensary and buy cannabis based on THC or CBD. You're buying cannabis based on the terpene profile. And so, that's one thing that I really loved about being able to see a doctor like Dr. Nina, is that she didn't turn down anything that I might have suggested about what I'm going to try and what I'm thinking about trying. She gave me her honest opinion and her feedback based on her own research and experience. And that's the kind of doctor you want, you guys. They're out there. Pray about it. But go seek it. Do a Google search. But there are doctors out there that can help create a custom treatment plan for you, for your body. Everybody is not the same. Like she said, we are all unique in our own ways. And even this disease presents itself in different ways in everybody that has the disease. So find you a doctor that becomes an advocate with you, that empowers you to be able to take advantage and take control of your treatment plan.
Yeah,
absolutely. And before we wrap up, ladies and gentlemen, I know we're trying to cram a lot of information into a little bit of time, but you will be able to go back, rewatch these videos, these words, these titles, these proteins that we've named today. Go back, and if you need to, screen record it. If you need to, write it down. Get you a dry erase board. They sell them at the dollar store now. Doctor, before we wrap up, from personal experience in working with patients and working within the cannabis industry, advising different entities, I would say that the best feedback and the best results that I have personally seen from patients is the application of topicals. Topicals for osteoarthritis, rheumatoid arthritis, lupus, and even gout. Your thoughts and expressions on topicals. And ladies and gentlemen, if you don't know what a topical it is a product that can be applied externally to the skin. It can come in the form of an oil, in the form of a salve or a roll-on, or even a cream or butter. So in regards to combining your practices with things they can do at home, what are your thoughts on the application of topicals and accompanying that with the polypharmacy approach of the acupuncture?
Oh, yes. I forgot one of the main modalities we do. I use CBD topicals every day with not just with my arthritis patients, with just about everybody. Anytime, in Chinese medicine, we do a lot of cupping and gua sha. So I use actually a CBD oil on all of my patients when I do the cupping and gua sha. So it's super powerful, super gentle at the same time. With my patients with rheumatoid, if they are not in an active flare-up and they have a common area of pain, I will do gua sha to move that. We talked about the traffic accident, to try to clear the traffic accident out of the way. And I always use the CBD topicals with it. So absolutely. I'm glad you brought that up because that's like a major player.
Yeah. So for everyone, I know I've got some family members watching. We've got some patient advocates watching. Topicals, ladies and gentlemen. So if the dietary things are difficult for you, you're having trouble accessing that, if you're not as well versed in your energy and some of the Eastern medicine beginning for you to help manage this pain versus some of the pills you may be taking, may be a topical. I know I've got a topical product that we've launched recently, and there are a lot of topicals on the market. So ladies and gentlemen, some of these topicals, you can even make them at home. So look into topical products. And again, a topical product is something that can be applied externally to the skin, and you can accompany that with the Reiki or some of the acupuncture practices on the days in which you're not going to seek treatment. So I know we're go ahead.
Oh, I was just going to say, and it's not just for pain and inflammation. It could also be for insomnia. It could be for nausea and the other types of symptoms that often come with RA. Not only pain. Yeah.
Because I learned this year that, through some of the flare-ups that I have, even some of my gastrointestinal flare-ups, I began to apply my topical at the site of it because it has peppermint and some other natural oils accompanied with the CBD. And I was shocked at my own stuff. I'm like, wait a minute. It's working on the stomach. So ladies and gentlemen, we have a lot of information. We're going to get ready to wrap up. Dr. Ibu Nina Tabor, thank you so much. Please tell our guests where they can find you, where they can follow you, and if they're in the Nevada area, how can they reach out to you?
But what's your website? So I can type it in.
I currently have our website down because we just did, as Nicole knows, we just did a whole bunch of videography and we're relaunching it and rebranding it. So unfortunately the timing is off, but if you want to send questions, you can send them to tribewithroots@gmail.com. You can send, let's do that one. That's the easiest to remember. I'm on Instagram and Facebook as well under Dr. Nina Tabor or the.good.witchdoctor, as you see here. It's a tongue-in-cheek that I used to get called a lot because of all my weird alternative health herbs and things, and I just kind of stopped fighting it and kind of went like, fine, okay, I'm a witch doctor if that makes it easier. So it just kind of happened that way, but so you can find me there. Yeah. And I'm happy to answer questions. If anybody has questions, I'm more than happy. I may not, if I'm with patients, I can't get to them always right away, but I will get to them eventually.
You guys, I am so pleased that I got to share my my witch doctor with you all today. She's an amazing practitioner. I am so grateful that I found someone like her here in Las Vegas, where I've made my home, and that's the important thing. I know that I've introduced this practice, these types of practices and modalities of treatment to other people that I care about, that are within my personal network. And the key is finding someone close to home. I mean, everybody can't fly to Las Vegas if you're in Georgia just to come see Dr. Nina. But it's important that you do find a doctor that is close to you, a practitioner that is close to you that you trust. Have a conversation with this individual first before you decide, that you want to make them your doctor. And I'm sure Dr. Nina would be comfortable with any questions that you might have that you should ask this practitioner. I'm sure she will be more than willing to share that information with you all. So make sure you email her if you have any further questions or follow up. Thank you so much, Dr. Nina.
You're welcome.
Love you so very
Thank you,
much.
Dr. Nina. It was a
It's
profound
been
pleasure. And I'll
yes.
definitely be reaching out to you the next time I'm out in Las Vegas.
Oh, great. Yes.
I can seek your services. So, ladies and gentlemen, this has been day 3 of the Minorities for Medical Marijuana Health is Wellness Week. And thank you for joining us for our discussion on rheumatoid arthritis. Be sure to tune in tomorrow at 12 noon Eastern, 9 p.m. Pacific, as we take a dive into multiple sclerosis. You're not going to want to miss this. Thank you for tuning in, and please take care of yourselves and each other.
Bye, everyone. Check you all tomorrow. All right. 9 a.m. Pacific, 12 p.m. Eastern Standard Time on our Facebook, LinkedIn, and YouTube channels. Can't wait. Thanks again, Dr. Nina. Thanks, Stanley. We'll see you guys tomorrow, guys.